and we're here with Emma Garton. She's the product manager for Aspen Medical Products.
I am. Welcome. Hi.
Hi. I know that Aspen is a very big name in the field. Back in, you were formed back in the 90s, and then around the year 2000 you merged, you took over another major company, and now you're really a dominant player in the space of durable medical equipment, braces. You have a tremendous product line in that area. So I just want to ask a couple of questions kind of in your field.
Great.
And first off, are there any new developments? I mean, braces have been around for a long time in chiropractic, but are there any new developments that you see from your point of view in the industry?
Definitely. So to mention your comment earlier, we're celebrating our 25th year in business as Aspen Medical Products.
Yeah.
And you know, I think one of the biggest things is chiropractors think about bracing, and they think that typically it's going to be used post-surgically for motion restriction, but what Aspen has done is we've really looked at addressing the secondary pain associated with injuries. So our braces are all designed to be inelastic, and we have this patented independent upper and lower compression mechanism, which really helps localize treatment to those paraspinal muscles. So it's really a great adjunct to current therapies that chiropractors are already doing for their patients. So it's going to help manage their pain rather than just restricting motion is what most people think of, but we have a full line of products that are really designed to address pain management.
Yeah, and you know, these can make a big difference in a doctor's practice because as a registered DME, I mean, all of your products have a letter, you know, from the CMS, you know, attesting that you're durable medical equipment, and so you can code for that, you can bill CMS for that, and so forth. You know, how does retailing DME or prescribing DME to patients, how can that help strengthen a practice?
Well, it's definitely an important component. We do have products that are coded and non-coded. The majority of our products are coded, and the rationale for that is not only is it going to help the patients, but it's going to help the practice. So with a coded product, you can actually bill insurance and receive a reimbursement, which has financial gain for the practice as well.
Yeah, and it makes it so easy when you've got all the paperwork and permissions in a row.
Exactly.
Yeah. Hey, just one more question. It's just kind of just something that I've always been interested in is the treatment of scoliosis. It's a pernicious problem. It affects a lot, women especially.
Right.
It's notoriously difficult to treat. How can chiropractors address that in practice? How can they play a positive role?
So chiropractors are already doing a plethora of treatments for these patients and that patient population. And Aspen recently released the Peak Scoliosis brace, and it's really designed for this adult scoliosis patient population that's suffering from pain associated with their scoliosis. So again, it's just going to reinforce those treatments that the practitioner is already performing for these patients. It really is designed as an unloader brace. It helps support that curvature so that the patient is out of pain and they're able to go about their activities of daily living. So the nice thing about this brace too is it's a short-term wear product. Most patients are getting benefit just from wearing it 2 to 4 hours, typically in the morning time, and then they have pain relief throughout the day. So
that sounds like a game changer.
Great adjunct to treatments, definitely.
Well, it was very informative. Well,
thank you so much. It was nice to meet you.
Thanks.